Bismillah Rahman Rahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Dear friends, my name is Muhammad Kamil Khan, and you guys watching my channel Kami Microbiologist. I hope all of you are well and fine. Today I am going to explain another lecture that is related to the autoimmune disease, and it is about the anti-KU antibody test. It is actually the test that is related to the ANA or ENA profile. I already explained the ANA and ENA profile. If you missed this, so go back to my channel, you will find out it. I also explained the anti-PMCSCL antibody test as well as anti-Smith antibody test as well. If you missed these videos lectures, you can go back to my channel and watch the video lecture related to this. Today I'm going to explain anti-KU antibody test. Now let's start. First of all, let's see that the introduction of this test. This anti-KU antibody test is actually a type of blood test, or we can say autoimmune related blood test, in which we find out the anti-KU antibody. Okay, in this test we just find out the anti-KU antibody. Now this anti-KU antibody, a type of autoantibody that are against the KU antigen. Now what is KU antigen? KU is a type of protein that are found inside the human cell nucleus, which are specially responsible in a DNA repair mechanism. Okay, now this auto antibody, like we have anti-auto-KU antibody, it is related to different type of the diseases. It means autoimmune diseases, like we have systemic lupus erythematosus, scleroderma, mixed connective tissue disease, and some other autoimmune diseases as well. Now remember, if you guys found this auto antibody, means anti-KU antibody, it means that this type of the antibody is secreted and they are mistakenly attack the body own healthy tissue, because it is also secreted from the amino cells as well, and it can target the body own healthy tissue as well. So this is a short introduction related to this anti-KU antibody. Now let's see that what are the purpose of this test. So this type of the tests are specifically performed for different type of the diseases, like we have scleroderma. And all of you better know that the scleroderma is a kind of autoimmune diseases in which the skin are become hard and tight. Now then this type of the test is also performed for the SLE, means systemic lupus erythematosus. It is also autoimmune diseases in which different organs are affected by the autoantibody. Like we have skin is affected, joint, we have kidney, lungs, okay, heart as well. So if these type of the organ and some other organ as well are affected by the body own autoimmune by the body own antibodies, so then this type of disease is called as systemic lupus erythematosus. Then we have mixed connective tissue disease. So it is actually a mixture of autoimmune diseases in which we have different type of diseases, like we have lupus, scleroderma, and polymyositis. So these are the main purposes of the auto-KU antibody test. Now let's see that when this test should be performed, when the doctor want to perform this test. So this test should be recommended when there is a muscle weakness, when there is headache, when the CK, means creatine kinase level are become high, when there is joint pain, when there is hard and tight skin, etc. So then the doctor recommend this type of the test. Now let's see the procedure of the test. So the procedure of the test are very simple, and it is very similar to the test procedure as we discussed in the previous videos. Like we have PMSCL antibody test and we have anti-Smith antibody test. So I already explained the procedure of this test, so the same procedure also in this case as well. Means this test can be performed using ELISA technique. Okay, ELISA technique, and we can also perform this type of the test using fully automated machine. What now if we see the procedure, so what first of all you guys have to do, first of all you have to take the patient blood and you have to collect 5 or 3 ml blood in a red top and gel tube as well. then you will leave it to clot so when the blood are become clot, so then you will centrifuge it. After the centrifugation you will get the serum. Now from this serum you will perform the ELISA test as well as means indirect ELISA test, and you can also run this serum with the advanced machine like we have Meglomi, Architect, Mendre machine, etc. Okay, so this is a very simple test procedure related to the anti-KU antibody test. Now let's see the result interpretation. So mostly the result of this test are given in positive and negative. If we talked about the positive result, so it doesn't mean that the patient have scleroderma and other type of diseases. If the positive result is detected, so other tests are also need to be done. Okay. Now in some cases there is also negative result as well, but it doesn't mean that the patient have not autoimmune disease. In some cases the patient have autoimmune disease but the tests are become negative. Okay, so be careful in this case. You have to perform some other tests related with this autoimmune diseases. Now if we talked about the normal range, so the normal range are less than 20 unit. Okay, if you see less than 20 unit, so it means that the result is okay. But if you see the value is above 20 unit, means 25, 26, or we can say 40 or 100, it means that the patient have issue like autoimmune disease. So dear friends, this is a very simple lecture related to the auto-KU antibody test. Thank you so much for watching this video lecture. If you like this video, make sure to hit the like button, share this video, and also subscribe the channel. And if you have any type of question, you can write your question through comment. I will try my best to give you answer as soon as possible. Thank you so much for watching.